My name is Krista Temple. I am a mother of two. I grew up here in Coquitlam, Port Moody. I started rowing in 2001 and went on a long 13-year journey rowing at the national team level, competed in 2 Olympic Games, and then retired and built my family here locally in North Vancouver. So I have 2 little kids, 2 dogs, and a husband. January of 2022, I was feeling like I was behind. I hadn't had my first mammogram, and I was feeling conscientious in that moment, and I decided to do a self-exam. And upon doing that self-exam, found a lump. So fast forward to my first mammogram, which was March of 2022, had a biopsy and was diagnosed officially on April 13th of 2022 with invasive ductal carcinoma, hormone-driven breast cancer. So I did I guess you could call it the typical run-of-the-mill treatments. I did surgery. So I started with a lumpectomy. We followed up with a mastectomy based on pathology. I did radiation, chemotherapy, as well as hormone suppression therapy. So pills that you take to block the hormone receptors so that hormones are unable to be used as fuel for the cancer. The last conversation I had had with my oncologist, I had discussed getting a PET scan as a baseline because he had suggested I go on capecitabine, which is an oral chemo. And in that first year, I really wanted to be free. I really wanted to move on. And so I was the patient that kind of wanted it all to end. And I needed a reason for it not to. So I said, would it be possible to get a PET scan as a baseline if I still have active cancer? That's an argument to take the oral chemo. However, I didn't get a follow-up with that until March of 2024. When I was going about my day, I had a sore arm, I thought, from walking a dog. It was sore across here and it would ebb and flow, it would get better. So honestly, I never even thought cancer. Never thought about it. I just thought it was a niggly injury, just an annoying arm injury. And I went out, did grocery shopping, loaded it all in the house. Felt like a snack, went to make myself a sandwich, and when I went to open the jar of pickles, my arm just kerclunk, just sheared right across my upper humerus. I had a glimmer of a thought on the way to the hospital. I said to the person that drove me, the ambulance attendant, I had had breast cancer. I hope this doesn't have anything to do with that. So I saw a surgeon, and then they got me in, and I remember cheering, like as if I had just scored a touchdown that I was getting that stabilization surgery, because it had felt like forever to just have your arm kind of cut and pasted on your body, to get dressed, to provide for my family, to do all the things. It felt like seconds were going by at a molasses-like pace. And I had my first PET scan on the 20th, which is my birthday, here at Initio. I feel like my story has been listened to for the most part, but there is such a limit as to what you can get regardless. It's not individualized treatment for all. That's not the system we live under. It's they have what they can offer you, and so if you need that, then you'll get it. But if you're needing something that they can't offer you, you don't. And it's not, we can't offer you this, go get it somewhere else. It's as if it doesn't exist. Here you are going home, becoming Bill Nye the Science Guy, or your own little mini version of a doctor yourself to advocate. And I'm in forums where I see people getting it wrong and thinking they need things they don't. I can imagine how frustrating that would be from the other side. I guess if we were informed better, we would know. 100%, if I could go back, I would get a PET scan in that January of 2023 when I was so-called free. I would get a PET scan right then, and I would have a benchmark. So now looking back, I would know, say that PET scan was clear, within 1 year, I had got 6 bone lesions. But if my PET scan wasn't clear in that moment, we would have immediately switched me. So the hormone treatment that I was eventually going to be prescribed is the one I'm on now. So I would have got on it earlier, and I wouldn't have had my arm break. So yeah, I would tell anyone, for $1,000, you can get a baseline. I don't think there is enough information for patients. I didn't think I was gonna have to navigate or advocate for myself as hard as I've had to. And to be honest, I'm not even sure that the average patient is capable of it. So it's really important that people get, quality treatment advice and have someone watching out for them. I think the work that Initio is doing is extremely important and valuable. I think timely scanning is critical to treatment plans. Having results in your own inbox and being able to navigate and look for the treatment that you require for your individual situation. And so having a place for people to go where when they're being told that they can't get something and that it doesn't exist, but that it actually does, is life-saving. To be able to get what I need at home, it's so comforting. Like I feel like at peace, I feel like taken care of. But now that I've had the ability to be able to navigate, in my time scheduling, quick results, and specialized, individualized treatment, I don't want to go back, that's for sure. I think bridging healthcare gaps with the private-public model makes a lot of sense. I think, if there's a way to create a solution to the problem, and if we have definitively defined the problem, it's huge. My overall experience with the Initio medical and staff has been amazing. Like I said, very personalized. I feel welcomed here. I have been able to request above and beyond and have been served in that request. So when I asked for dual phase, we found a way to make it happen. I'm able to contact someone, a human, when I call, it's funny because you wouldn't think that that's that big of a deal, but it is. And when you're wanting something like yesterday, it's important to be able to get on the phone and to be able to advocate for yourself and to be able to talk to a human. And it's hard to get a hold of people in our system.